Well, one of the things that really motivated me is my personal health. You don't know until you lose it, but I had great health. I had always been a college athlete. I was a professional volleyball player. And in one day, my life turned around as I contracted necrotizing fasciitis. And then for the next year, I was stripped of all the health and vitality and couldn't do any of the things I love to do as I was 12 months recovering from this disease. And at that point, I was changed. I became aware that health and vitality was a gift, and it was a gift that I wanted to help other people achieve as well. As far as some of my attributes, I think I'm a people person. I love engaging with people. I find satisfaction and joy in being with them, and even more so helping them. And I also love the hunt. I love finding out what's wrong with them, whether it's diving deep into the blood work, calling a pharmacist, calling another medical doctor, finding out, getting to the bottom, what is wrong with this person and how can we help them the best. As far as success, I'm completely confident that I'll have success in this program. I was in the Weber State nursing program as an honors student, and I had great success there, and I fully expect it will continue. Who has influenced my professional career most to this point is the family nurse practitioner that I'm currently working for. I've been there 6 years, and she's had a family practice for 20 years. Her knowledge and skill is amazing. I've learned so much. And I've seen a family practice in action. I've seen what it means to follow a family through the course of their life, and I love it. It is kind of what really helped me determine that that's what I want to do with my career. What's influenced my professional career, I would say, is that I've had a lot of patient responsibility. Everything from initial intake with a patient to following them through with their care plans and explaining blood work and procedures and lots of patient education. And I've been a manager of my department, so I've had the opportunity to experience what it means to be a manager, everything from ordering to working with employees. And that's been a great experience. But I'd say most of all, who's influenced my professional career is the individual people. I just keep seeing faces and I feel their stories of people that I have genuinely connected with and come to really care about and really cared about their improving their health. And how can this DNP improve my professional career? Well, I will be able to learn how to analyze data and bring it into a clinical setting. I really want a science-based practice. I will be able to view healthcare from a wider lens and maybe hopefully be able to influence policy. And I'll have the skills to connect other healthcare disciplines together so we can bring better patient outcomes for the people I'm working with. First of all, the DNP degree is an academic degree. It's not a role. Where the FNP is based on patient care, it takes that role and adds upon it. It adds skills in technology, business acumen, increased leadership, increased communication skills, learning about healthcare policy and how to navigate that. A lot of these things, in fact, are learned in the DNP project, where you take something that's clinically significant, a focus that you want to do, and focus on that using all of these skills. It actually can be patient-based, practice-focused, or research-focused. A DNP, it's very, very important for a DNP to collaborate. They're really good at collaborating with different medical disciplines and connecting different medical disciplines for best patient outcomes. DNPs are going to be the ones that are leading the forefront for political policy, for healthcare policy, and learning to speak articulately and make changes, see what they're seeing at the clinical level, and go and make changes for better patient outcomes. And with healthcare is changing so much right now, socially, politically, economically, and even the healthcare itself. We're seeing problems we've never had before. We're seeing increased infertility. We're seeing less immunization, less vaccinations, and more problems with that. We're seeing a lot more chronic disease. Healthcare is really changing, and the DNP has to be on the forefront of that. They're the leaders in making these changes and disseminating the science down to the clinical levels. And they're going to be very important in going forward. There's so many changes right now. The FNP is, they're patient-based. They are experts in diagnosing patients, in coming up with treatment plans for patients. They will be prescribing medications for patients. They need to be experts in treating chronic illness and treating acute illnesses. And really important for an FNP it is really important for an FNP to treat the patient as a whole. If there's one thing I've learned being in this clinic is that no one blood value stands alone. No one symptom is a symptom by itself. The body is a whole body, and every symptom, every small thing is interconnected, and we need to see patients as a whole, and that's a very important part of being an FNP is treating the patient as a whole. I want to be, first and foremost, the best practitioner. I want to be a very evidence-based practitioner that takes the latest science and analyzes it and digests it down to a clinical level. I want to be able to give my patients the best and latest research-based treatments. And it's a dream of mine to have my own or be part of a vitality clinic where we start and from the work backwards. We start and say to the patients, what are your goals? What do you wish you could be doing right now in your life that you can't do? And we make a plan. We give them some ownership of their health care, and either we find the resources to do the things that we can't do, but in the end, it's all about bringing more increased vitality to each and every person.